Hello everybody, it's Barry Munir. Today I'm going to be talking about jumper's knee, otherwise known as patellar tendonitis. My goals for this video are to discuss what jumper's knee is, how to overcome and go over different ways to treat it and how it is caused, and then finally discuss the stretching routine which I've created for my patient. Before I go over the symptoms, I'm going to talk a little bit about what jumper's knee is. Jumper's knee, also known as patellar tendonitis, is an inflammation injury of the patellar tendon, the cord-like tissue that joins the patella, otherwise known as the kneecap, to the tibia, which is your shin bone. Jumper's knee is an overuse injury, which is when repeated movements cause a tissue damage or irritation to the particular area. Constant jumping, landing, and changing of direction can cause strains, tears, or even damage to the patellar tendon. So kids who regularly play sports or get involved in a lot of repetitive jumping, such as track and field, particularly high jumping, basketball, volleyball, gymnastics, running, and soccer, things of that nature, can put a lot of strain on their knees. Jumper's knees can seem like a minor injury that isn't that serious. Because of this, many athletes keep training and competing and tend to ignore the injury or attempt to treat it themselves. But it's important to know that jumper's knee is a serious condition that can oftentimes get worse and ultimately require surgery, which is a big issue. Early medical attention and treatment can help prevent continued damage to the knee. Now that you know a little bit about what jumper's knee is, I'm going to go over a little bit of the symptoms, such as swelling, bruising or redness, and discomfort or pain during physical activities. The swelling, the tendon and the surrounding muscles will swell due to excess fluid or edema. That's just when excess fluid builds up in the area and it causes swelling. Bruising or redness, overuse of the patellar tendon in this state can cause bruising in the tendon that can worsen with the state of the tendon being used repeatedly more. As far as pain is concerned, you're going to feel pain during physical activity, and it'll often go away shortly after, if not a period of time after, and that's often why athletes put off going to see a physician about it or a physical therapist or getting treatment, or they'll either try to treat it themselves and not be treated properly, which will cause greater issues in the long run. A lot of these symptoms actually come from how the knee works and how it's used during these physical activities. So when the knee is extended, the quadricep muscle actually pulls on the quadricep tendons, which connect your patella to your thigh muscles, or otherwise known as your quads. This in turn pulls on your patellar tendon, which connects your patella to your tibia, or your shin bone, and allows the knee to straighten. In contrast, when bending the knee, the hamstring muscle pulls on the tibia, which causes the knee to flex, which puts stress and stretch on that patellar tendon. In jumper's knee, the patellar tendon is damaged. Since the tendon is crucial in straightening the knee, damage to it causes the patella to loosen or any support or anchoring that the knee has. This causes pain and weakness in the knee and leads to difficulty in straightening the knee. So looking at my patient, his name is Jake Brown. He's a 19-year-old long jump track athlete. He came to me with a complaint of having some trouble with pain in his left knee. It acts up when he begins to jump, and I want to catch it before it turns into anything severe. This is very good that he came to me early on so that it doesn't turn into anything severe, because if it were to progress into permanent damage of that tendon, he would need to undergo surgery in order to repair that tendon. Upon further examination, I found that he had pretty bad swelling of the right knee. He had a lot of trouble with mobility, straightening his knee and bending his knee. Bending his knee hurt his knee quite a bit, and then he had trouble straightening it against resistance. He also had discomfort and pain with activity, as I explained before, with bending and straightening the knee, and he also had redness of the patellar tendon in that area. So after examining him, I diagnosed him with what is known as patellar tendonitis. My plan for him is a routine of stretches that I have hand-selected for him that will be performed in and out of the office or facility that will hopefully lead him to a full recovery and speed up his recovery process. This is provided that all the stretches are completed in and out of the office at home as well. So as you can see here, here's a list of stretches that I provided for him. There are only 4 right now because as we progress further with his recovery, we're going to add more and more, and those will be added as he comes back and visits on later dates. But for right now, these are the 4 that I'm starting him off with, and at the top is going to be the ice cup massage. I include this one a lot with a lot of therapies and recoveries because it's a great exercise, it's a great massage. It increases circulation and blood flow into those tendons and injured muscles, and it will actually increase the speed of recovery as those muscles are going to get more nutrients and they're going to be able to heal faster. The next thing that I've applied is the patellar tendon massage. This is what you're seeing at the very top, this top picture right here in the middle. And what you're going to do, it's best to have somebody else do this. You can actually do it yourself, you just will not be able to get as good of a massage in. What you're going to do is, if you are the other person or if you are having somebody perform this on you, have them with their non-dominant hand support the patella, keep it in place, don't allow it to move. While with your dominant hand or their dominant hand, they're going to move across the fibers of the tendon, massaging and applying as much pressure as comfortable. Now with that being said, a little discomfort is going to be okay, as what you're feeling is the breaking up of those tendons, and it's actually going to allow those tendons to heal faster because they're not going to be so tight. It's going to increase circulation, as I was talking about before with the ice cup massage. And for this next stretch, the proximal patellar tendon stretch, I'm going to do my best to explain it in full depth. I could not quite find the picture that would represent this stretch well. Nonetheless, when my patient comes in to visit me, I will show them exactly how this stretch is done and how it's meant to be done in the facility and at home as well. First off, what you're going to do with this stretch is you're going to take whichever hand you are comfortable with, and where that patellar tendon, the one closest to your foot, where that patellar tendon connects to your patella or your kneecap, you're going to support with your fingers. And you're actually going to apply pressure and pull up towards your hip. Now you're going to start with your knee in somewhat of a locked out or straightened position. And while you're supporting your patellar tendon, you're going to stretch or bend your knee as far back as you can up until there's a point of discomfort. Once you reach that point of discomfort, you hold it there for a slight second, and then you're going to release the leg back out into a straight or locked out position. And you're going to do this roughly 10 to 15 times, or however many times, depending on the severity of your injury, however many times that I am going to give you. Moving on to the quadricep stretch. This is a fairly well-known stretch. It's performed in a lot of sports. What you're going to do is, shown in the right hand picture, you're going to grab the front of your ankle and you're going to pull it up towards your butt. What this does is, not only does it stretch out the quadricep muscles, but because it's applying stretch to the quads, it's also going to apply stretch to your quadricep tendon, which is the tendon located above your patella, which in turn is going to stretch out that patellar ligament or tendon. It's important for you to keep flexibility in that tendon while you're going through recovery so that it doesn't tighten up and you are not to hurt it again in the future. And with that being said, that last stretch being explained, that's going to conclude my video. Thank you all for joining in, and goodbye.